If you have an SI joint problem, which would be pain here where your tailbone meets your pelvis, I guarantee you muscle tension is contributing to that. I've seen this time and time again in my practice where people come in with pulling or aching or chronic pain right in this area. It's like the dimple on the back of your pelvis and right above your glutes. This area is your SI joint, and it is absolutely connected to muscle tension. I'm going to share with you in just a minute why. If you look at this skeleton, you'll see that there's quite a few muscles that attach to this pelvic bone here. We have the muscles in the front of the hip, which are your hip flexor muscles called commonly. We have your iliacus and your psoas muscles. Those, when they have tension, which they have tension in most people, they will pull the pelvis forward, because they're in the front of the body. If you think of them like a pulley, they're attached to your leg bone, your femur. When they're pulling forward, it causes a rotation in this direction, which then puts pressure, tugs on the SI joint. And there's a bunch of ligaments that are intended to hold this in place, but they become strained over time, especially if this tension is chronic. Now, in response to these muscles in the front pulling on the pelvic bone, the muscles in the back of the hip, in your glute area, will play tug of war with them. Your body wants to try to maintain a sense of normalcy, a sense of balance, but when there's constant tension at the front, these muscles in the back are going to say, hey, wait a minute, we don't want you to fall apart. So they will create tension too. And there's an important muscle called your piriformis muscle, which is right here, actually attaches to the underside of your SI joint. And this muscle in particular tends to become very tight when there's irritation to the SI joint and when there's tension in the front of the hip. So if you have developed tension in the front of your hip from sitting too long, if you're very flexible, like if you've been a dancer or a gymnast or you've done a lot of yoga, that can cause tension here. And I talk all about this in my best-selling book, Tight Hip Twisted Core, The Key to MSL Pain. You could have tension here from certain athletic activities. And typically it's an asymmetry, meaning where one side is tighter than the other. And that's pulling more on one side, which is tugging more on one area of the pelvis versus the other. So if you're experiencing SI joint pain, it's almost a slam dunk to make sure and really address muscle tension in relation to this pain. Without reducing this muscle tension, it's very uncommon for this to resolve for good.